As always, I'm sad to always start by noting that we've had 24 additional people who passed away, 14 people who died had underlying health conditions. The total number of deaths is staggering at 27,625 across our county. And our prayers and thoughts are with everyone who's lost a loved one, a friend, or a neighbor during this extraordinarily difficult time. We're also reporting 20,198 new cases today. This is more than triple the number of cases we reported last week. And it brings the total number of cases in LA County to 1,669,545. Again, a staggering increase. To date, more than 10 million people have been tested and had test results reported in LA County. And our daily average case rate, as you can see, has now increased more than threefold since last week to 109 new cases per 100,000 people. CDC's estimate of our weekly case rate is up nearly fourfold to 724 new cases per 100,000 residents, with a continued very high level of transmission across the county. As you could see, at 21% of test positivity, it means that, really a fifth of people that are getting tested now have a positive result. And these are the tests that are reported to us. There's 1,251 people currently hospitalized with COVID, also a near doubling since last week. We've now opened 494 investigations that are active at residential settings and non-residential settings. These are places where we have at least one confirmed case of COVID-19. And this is a 10-fold increase over the number of investigations we've opened at this time last week. So yes, we can go on to the next slide. So yes, we are in fact experiencing the worst of a surge at the moment with the rising number of cases. And as you can see here, the slide is showing the cases, hospitalizations, and deaths between July 1st of last year and December 30th. The cases are in green and the deaths in blue are presented here by the date they were reported, and hospitalizations in orange are presented by the date of admission. And you can see in the most recent days, cases have shot upward by 200% in just 1 week, and hospital admissions increased by 100%. You can see if you look at the previous surges on this slide that hospitalizations and deaths lag behind cases. Hospitalizations usually start to increase about 2 weeks after cases increase, and increases in deaths often don't follow for another 3 or more weeks later. As you'll see, deaths, a lagging indicator here is represented by the blue line, fortunately remain low and they haven't changed, but this is because we're really only about a week out from when our hospitalizations started rising. Next slide. The trend line on this slide shows the daily average COVID hospitalization census countywide. And this helps describe in part the burden placed by rising COVID transmission on our hospital systems. The upward pitch that you're seeing on the line near the end of this graph is showing the beginnings of the increases in hospitalizations that we're seeing over this past week, where we went from 752 to 956 on December 28th. Today's numbers, as I said, are even higher. We're at 1,251 daily hospitalizations. And while hospitalizations thankfully remain significantly lower than what we experienced last winter, we do need to closely monitor the impact of the very recent explosion in cases on our healthcare facilities.